So we look at chronic sinus tract formation. So we spoke about the sinus tract, and we said the sinus tract is usually formed when there's accumulation of pus inside a body compartment. So if there's accumulation of pus in a body compartment, the pus will now come and make a route so that what it can be able to flow to the outside environment. Okay, so when they say there's a chronic sinus tract formation, it simply tells you that that condition has been there for a very long time, and if there's now continuous flow of pus from the inside to outside, it can make it that there's a very big wound on the outside, and sometimes can predispose the patient to infections and all of that, So you can see it looking old, right? It's looking old. The issue has been there for a very long time, So it just refers to development of an abnormal channel tract that connects a focus of chronic infection or inflammation inside the body to the skin surface or another epithelial line structure. So if you say it is chronic, it shows you that what the pathology has been there for a very long time and it has refused to heal. So a sinus tract is a blind-ended channel. It's lined by granulation tissues. Usually it opens on the skin or mucosal surface on the outside so that there is drainage of pus. So when we say it is chronic, it simply means it persists over a long time because there's an infection there and the infection has been there for a very long time. So it often drains pus or serous fluid intermittently. So pain or swelling may be associated with localized tenderness or recurrent inflammation. So common causes could be all those chronic osteomyelitis, could be dental infections, could be maybe after surgery complications, could be due to tuberculosis, could be actinomycosis, could be pilonidal diseases, So pathophysiology is, yes, there's infection, there's tissue necrosis, there's granulation tissue formation. So the body attempts to drain the pus by forming a sinus tract to the surface. So if the sinus tract remains open for a very long time, that's when we now say there's a chronic sinus tract formed there. So management principles: you identify the underlying condition and try to tackle it. You give antibiotics because you want to treat the infections that are already on ground. Then surgical excision of the sinus tract if it persists.